The Keto Diet, Changing Outcomes for Diabetics by Cecilia Martin. The incidence of diabetes has nearly doubled over the past 30 years, with 170 million currently diagnosed. Future predictions indicate an increase to as many as 366 million by the year 2030. What, if anything, can be done to reverse this devastating disease? How might we protect ourselves from ever being diagnosed? That is the million-dollar question. There have been some insights into a way to stop and even reverse the disease that is safe and effective. The keto diet has been around for centuries as a therapeutic diet for many ailments. Though the diet has faced harsh criticism from those who don't benefit from it financially, diabetics should consider adopting a ketogenic diet to reduce cholesterol, lose weight, and increase the effectiveness of their own body's insulin. What is a ketogenic diet, or keto, and why is it different from traditional methods for weight loss and glucose control? A ketogenic diet is one that utilizes high fat, adequate protein, and low carbohydrate foods to fuel the body. Many who have heard of ketogenic diets picture someone who eats 3 eggs with bacon, butter, and lard on the side for breakfast, chicken wings and cheese for lunch, and a giant steak for dinner. In part, they are correct. All of these foods can be part of a ketogenic diet because when your body is in ketosis, your body's alternate fuel-burning state, you burn primarily fat for energy. In traditional low-calorie diets, fat is restricted, and calories are very closely counted to achieve weight loss. Alternatively, in a ketogenic diet, carbohydrates are strongly restricted to force the body to enter and remain in ketosis, the fat-burning state. When your body does not have an adequate supply of carbohydrates, which it turns into glucose to be used by the brain and cells for energy, it does a few things. It ceases to make fat and store it, and it also begins to convert dietary fat as well as stored fat into ketone bodies. These ketone bodies are used by the brain's central nervous system and cells for energy. As it turns out, the ketone bodies actually provide more energy than an equal amount of glucose. Because the body uses ketone bodies so efficiently, many people who try the keto diet report a surge in sustained daily energy even when they're fasting. Why then should diabetics care if their body is burning fat or glucose? What's the benefit of going into ketosis and using fat as fuel? When the body burns glucose as fuel, any glucose not used by the cells remains in the blood until insulin comes along and forces it to be stored as fat. Our typical standard American diet is filled with carbohydrates, which quickly turn to glucose and overload our body's cells with more than they can use. When the body is no longer able to keep up with the glucose or carbs we eat, more insulin is demanded from the pancreas, causing us to store more fat until finally we're diagnosed as insulin resistant or even diabetic. Our doctors then give us medications to demand even more insulin from our pancreas, causing even more strain. The extra glucose floating around in the blood is damaging to the walls of the arteries and capillaries, causing many of the side effects noted by diabetics such as blindness, neuropathy, and cardiovascular disease. When the body converts to burning fat as fuel, much less insulin is required from the pancreas, giving it a chance to rest. The skeletal muscles, those we use to move, clean up all of the excess glucose floating around before beginning to burn ketones. Without the excess glucose damaging the arteries and causing inflammation, they can begin to heal. A study was done that showed that those placed on a low-carbohydrate ketogenic diet versus a low-calorie diet saw a greater reduction in A1C, which is a measure of blood glucose over time. They also showed a greater effect on weight loss, glycemic control, and waist size than those following a typical low-calorie diet. While eating a diet full of meats, cheese, and full-fat dairy, keto dieters increase their good cholesterol, HDL, decrease their bad cholesterol, LDL, and decrease their triglycerides. Most exciting in this study was that many were able to reduce or eliminate their diabetes medications because of the ketogenic diet. This is not something that can be accomplished through traditional medical treatments, which makes it astounding that it could be done with only a change in what was eaten by the patient. The keto diet isn't new by any means. It's been used for hundreds of years to treat many ailments, but has seen a growth in scientific proof of its promise in the last century. Although there's more research to be done before the keto diet will become a mainstream treatment for reversing diabetes, I believe that those currently suffering from the disease should consider adopting a ketogenic diet. Obviously, this should be under the supervision of their doctor, as medications will hopefully need to be changed or eliminated as the body adjusts to burning ketones rather than glucose. Also, as there's not one perfect caloric balance for every body, an individualized assessment is needed to design the right blend of macronutrients for each individual. Imagine being able to stop taking blood pressure medications, pain medications for neuropathy, and medications focused on glycemic control. Imagine not only feeling better, but truly healing your body and letting go of nasty side effects of those medications. Though the effort to follow a keto diet may be difficult, the benefits of reduced medication use, more energy, lower cholesterol, and weight loss make it worth the time and energy. Why would people continue to take more medication when they could heal their disease by simply changing the way they eat?